Hello, welcome back again to another edition to Columbia University's Casual Conversations on the Columbia Surgery page. I am Brennan DeBose, and today we have Dr. Craig Smith. Dr. Smith, how are you doing today?
Very good.
Good. So I want to dive right in with you. Thank you so much for taking the time to speak with us today.
My
We are
pleasure.
so happy to have you, and we know that you're busy, so we're super happy to be able to speak with you today.
Okay.
So my first question for you is, what first interested you in becoming a doctor?
Well, I had grandparents who were both doctors from a much earlier generation, of course, grandmother and grandfather, and they were both good role models. So I had that sort of ingrained from the beginning. On the other hand, I'd say the most important personal contribution to that history was when I had a number of injuries myself growing up and had hospitalizations for mostly fractures and various teenage calamities that put me in the hospital. A bad ankle fracture that put me in the hospital for a couple of weeks. A steel mill accident that a broken pelvis that put me in the hospital. Knee operations. So I had a number of medical encounters, mostly more or less orthopedic, and had just gotten kind of a taste for what it's like to be on the receiving end and an admiration for the people who took care of me. So that was probably the most single important feature of the background. And then after drifting, well, not drifting, but doing well in college, but then drifting for a while after college, and I realized that the world of pure science and a PhD was not for me, and I reoriented towards medical school, and that's where I went.
Mm.
You wanted to know about the specific specialties, or are you going to keep queuing questions?
Oh, absolutely. The questions
Yeah.
keep going, Dr. Smith. But I want to know, so as a boy, I know that you read a book called The Century of the Surgeon.
Yeah.
And I want to find out, what would you say that you would recommend to young adults who are interested in medicine? What book would you say you would want them to read that might give them some inspiration?
Well, I have to say, I don't know if that one is still relevant. That one captivated me at just the right age, which was, 12 or 13. And there was a summer when I spent the summer reading. I'd get up early in the morning, and we were at our summer place, and go start the wood stove myself and sit there and read it for an hour or so, and plowed through it and enjoyed it immensely. Whether it would capture anyone today, I have no idea. There are probably far better books, and I'm not sure I can give you a good list that really captures. It was a book called The Surgeons that was written about, actually it was done here by a well-known author, Charles Morris, who embedded himself in our surgical department for a little over a year, actually, and well written, a lot of good insights into what doctors do.
Mm-hmm.
It's fairly heavy on the cardiac side of things,
Mm-hmm.
but a broader perspective than that. He's not a physician, he's more of an economist and so on, but that's probably okay.
Okay.
There are probably far better sources. I can't say I've looked into that literature much lately.
Okay. All right. Well, that sounds good. So I'm going to tell everyone to check out that book. So my next question for you is, what is your specific practice, and why did you choose it?
My specific practice is adult cardiac surgery, which the way it is today for me means valve replacement, valve repair, coronary bypass, major aortic procedures. When I started, it included a little different spectrum, much more heavily at the time on early days of heart transplant, the very early days of heart, lung, and lung transplant. And those were very exciting in their day. I'm not that involved with those activities now. Those have been picked up by younger, more energetic, and probably far more intelligent people underneath me.
Oh, Dr. Smith.
But that is, it's all heart surgery. And I had never seen heart surgery, didn't know much about it until I was an intern. And had gone into internship thinking I'd go into one of the standard choices, orthopedics, plastic surgery, something like that. Found orthopedics beyond boring. And just once I saw heart surgery, it was the most compelling thing I'd ever seen, and I knew that was it, and never looked back.
You've done so many surgeries, and in 2004 you did a surgery on President Bill Clinton.
Yep.
In 2010 you did perform surgery on Barbara Walters.
Yep.
What would you say is probably one of the most exciting new developments in the cardiac surgery world that really has caught your eye?
Well, it's not operating on celebrities. The most exciting thing in my career, well, I would say two things at sort of different poles. One is when I started out, thoracic transplantation, heart, lung, was very new, exciting, a real frontier, and was very exciting and very fun to be involved with because it was at a stage when we really were making it up as we went along. And that's, at least in my opinion, always the best, most enjoyable part of something new. As it gets worked out in the textbooks and algorithmic, it just becomes much less interesting. And the second invention or new development is the catheter replacements of aortic valves, which is in the process of revolutionizing the way we treat aortic valve disease, and was unexpected in the sense that most people who looked at this technology early on thought it couldn't work. Right out of the gate, it appeared to work better than we guessed, and within a short period of time, proved that it is a very competitive treatment with the gold standard of open heart procedures. It will not completely replace the need for open heart valve replacements, but it plays a huge role and is really transforming the way that's done, and probably the biggest development in my field in 30 years. And I had the privilege to be a big part of that because the trial was centered here. So probably those two things.
Dr. Smith, I love the fact that you go back and you look back into your past and then you bring it into the future and like kind of like what the work is right now, and you compare and contrast this. That's what I'm kind of getting a lot from this conversation. And my next question for you is, over the course of your career, you've seen a lot of changes. You've seen a lot of developments. You've seen a lot of evolutions. What would you say specifically is the biggest change in the way that we treat and manage heart disease?
Well, in terms of what I do to treat heart disease, the biggest change is probably the advent of the catheter-based valve replacements that I just spoke about. In terms of, in the broader context, the ways we treat heart disease, it would probably go back to things that are more medical and statins and a variety of other medical treatments that have evolved more slowly over 20 or 30 years, but have, in aggregate, combined with this whole cluster of medications plus surgery, stenting, and so on, have had really dramatic impact on the survival of people with heart disease and prevention of a certain amount of heart disease. But it's hard to pin down, at least for me, one single thing that's made the biggest difference.
Okay. So my final question for you, Dr. Smith, is what's unique about practicing medicine here at Columbia University Medical Center? And what would you say is the most rewarding part of your job?
It's hard to exactly define what makes this place unique, but there is something in the air and water that just hooks people on the environment and keeps them here, and gives the place a sense of purpose and excitement that is tinged with anarchy and uncertainty, that has something to do with being on the margins of the future all the time. It's just a very exciting place to work, always has been. And some people walk in and can sense it fairly quickly. Not to say it's an easy place to work every day, but it's a very exciting place to work every day.
So you would say that the excitement is the most rewarding part of your job?
The most rewarding part of my job is the privilege of taking care of patients and having them put their faith in me or my colleagues to do sometimes high-risk procedures that have high reward, and to share in that. That's for all doctors, whether you do heart surgery or whatever it is. That's the real privilege of being a doctor.
Real privilege of being a doctor. Well, Dr. Smith, it's been a privilege to be able to talk to you today.
Thank you.
And I appreciate your time.
Anytime.
Thank you.